Hello, my name is Dr. Shane Martin, and today we'll be going over diabetes from a holistic and alternative perspective without, in a sense, treating diabetes without things such as surgery or pharmaceuticals. So again, I'm Dr. Shane Martin. I'm a chiropractor. I have an office called Mission Clinic. I work with as a partner with Total Health Center. Anyways, today we'll be doing an overview of our diabetes. So what I first want to do is I want to educate you as to some of the underlying conditions behind diabetes. I want to give some tips, some do-it-yourself tips on how to manage and treat diabetes yourself. And then I'll give a plug for my clinic, just giving people an overview of what I do, what to expect, and at the very end I'll throw in a coupon. And this is really fascinating today because part of the treatment, I've experienced this with patients. There's one treatment that will allow you to manage, even drop your blood sugar if it's high, even like 100 points within even like 20 seconds. I've had patients do this with a lot of success. So let's dive in. So the first thing I want to do is I want to look at the philosophy of disease, or where disease comes from. Because in modern medicine, the philosophy or the theory of disease is that diseases are caused by germs, parasites, viruses, bacteria, something exogenous, something outside of you that infiltrates you and causes disease. So with the alternative or holistic naturopathic perspective of disease is that disease is an imbalance. So the body can deal with stress, chemical stress, emotional stress, and structural stress. And so when there's too much stress in any one of these categories and the body can't compensate anymore, then it degrades into dis-ease or disease. So my job is to find those stressors and to remove them, because we believe and we've experienced and seen that the body is very good at healing itself. So first I'm going to look at glucose. So the question is, okay, where does sugar or glucose, where does it come from? Because what happens is you have sugar, glucose, and then it goes in the body, and typically there's a glucose as well as ketones that provide energy for the cells of the body. So where does the glucose come from? Because with diabetes, you have a misregulation of sugar in the body. So let's talk about that. So first off, glucose comes from our diet. Obviously, if you eat fruits or carbs or any sort of food, that's going to be turned into glucose. The next is called glycogenolysis. That's where stores of starch in the body or glycogen can be broken down and turned into sugar. And the third source of glucose is called gluconeogenesis. These are big medical terms, and what it means is the proteins in the body, if in a starvation state, can actually break down proteins and turn them into glucose for the body. So just talking a little bit about sugar. Next, let's talk about how the sugar is regulated, or specifically what organs are going to be regulating how much sugar is actually in your body. And this is important because as a doctor, I need to be looking at each of these organs or glands and make sure they're functioning well. So we'll be looking at the liver, the pancreas, and the adrenals. And so these are the glands or organs that will be regulating the sugar. Next, we'll be looking at misregulation. We'll be looking at insulin and glucose, or how they work together. Or more specifically, we'll be looking at insulin. So what is insulin? You have glucose floating in the body. The question is, how does the glucose or sugar enter in the cell? So insulin is a hormone, and it attaches itself to a cell and allows the glucose in the bloodstream to actually enter the cell. So if you have insulin present, sugar enters the cell and the cell can function normally. If there is no insulin, then there's no way for the cell to absorb any glucose and the cell dies. So next we'll be talking about insulin because you want to manage your insulin well. So diabetes typically revolves around how well insulin is regulated in the body. Okay. Next, we're going to look at categories. This may be a little confusing, but bear with me. I mean, all this is very important. So first off, you have, I'll deal with the two categories first. First, you have hyperglycemia. That means you have too much blood sugar in the bloodstream. Secondly, you have hypoglycemia. That means you have too little blood sugar in the bloodstream. So in hyperglycemia, why do you have too much blood sugar in the bloodstream? Well, number one, you have insulin resistance. And this is the big one. This is the one that you can control more readily. This is the one that's most common, even epidemic, across our country. So with insulin resistance, even though insulin is present, the body is no longer responding well to insulin. So more and more and more insulin needs to be produced for the body to absorb adequate amounts of sugar into the cell. Secondly, you have low insulin. Let's say the body's not even producing insulin. That's why people, these are called type 1 diabetics. Insulin resistance, that we're dealing with type 2 diabetics, and usually these people tend to be much more fat, even obese. People with low insulin, these people tend to be very thin and skinny. And so the issue here is the body just isn't producing insulin. Okay, again, this is what we'll be focusing on here. Next we'll talk about hypoglycemia. This is important as well. We have low blood sugar. You just don't have much blood sugar in the body to begin with. And so why is this? So typically it's because the body's producing too much insulin, right? And so the body is absorbing the blood sugar or sugar in the blood at a very high rate. So there's not much blood sugar in the blood. Usually the cause of people with hypoglycemia, and again, we're not talking about type 1, type 2 diabetics. This is different. Usually we're looking at and there's debate in the medical field as to what the underlying causes, but it can be a tumor. You have a tumor in the pancreas that can be causing too much insulin to be released, or you can have something called functional hypoglycemia. That's where the stresses like emotional stress, physical stress, chemical stress can be affecting the body. So let's go on to the next slide. All right, now insulin resistance. So remember, insulin resistance, this is when the body's producing insulin, but the body's no longer responding to the insulin that's being produced. Now why is that? So typically, some of the causes of insulin resistance is either stress, emotional stress, chemical stress, or insulin insensitivity. Actually, or if a person is eating too much sugar or refined carbs. So the problem is especially with our American diet, is not only are we eating too much sugar or too many refined carbohydrates or processed food, but we're eating not like 3 times a day. We're eating like maybe 5 times a day. So we're constantly putting food in our bodies, and we're constantly putting insulin into the bloodstream so much the body stops responding as readily to the insulin because it's there all the time. So with insulin resistance, well, we want to be controlling a few things. We want to control how often we eat, how much we eat, and exactly what we eat. In this case, junk food, processed carbs, and sugar. We'll talk more about this because this is very important. So let's talk a little bit about the secondary issues. If you have type 1 or type 2 diabetes, or in this case, hyperglycemia. So these are secondary issues that you may notice, right? Number one, your bloodstream, the acid may be, the pH levels might be high or low, too high or too low. You might have arteriosclerosis or plaquing in the blood vessels, and if they get damaged, they harden and become brittle, and they can break, and they can cause internal bleeding. You have gallbladder issues. Your body can be in a state of ketosis where it's not getting the sugar it needs, the glucose, and so it starts using fat as an energy source, which isn't a bad thing. Or the lymph nodes in your body can get infected, or obesity. You can lead to obesity, or adrenal fatigue syndrome. I've talked about adrenal fatigue syndrome in a separate whole seminar, and it's very significant. So let's talk a little bit about exams. So in pharmaceutical medicine, or just in general, there's some examinations you use to get diagnosed for diabetes. You have a 5 to 6 hour glucose tolerance test, but that's where you're supposed to fast, I believe, for 5 to 6 hours, and then you're told to have a large carb meal before the results. That can give you false negatives or false positives, and that's typically what your medical doctor will prescribe. Next, we have an 8K evaluation, or applied kinesiology. That's what I practice. So in this case, what I do is I look at the liver, the pancreas, the adrenals. I make sure these organs and glands are functioning well. I can do that very effectively. So I'll tell you a story with the gallbladder. It's interesting. I had oftentimes sometimes when people have pain, I've had patients who have had pain in the right side of their abdomen, and they thought it was the gallbladder. Medical doctor thought it was the gallbladder as well, and they figured that they had to have it removed. Well, it turns out it was simply an ileocecal valve, which you go into. This is something that can be fixed very easily. It can be fixed in 60 seconds, which I did, and the pain went away instantaneously. And again, you have like adrenal fatigue syndrome. That's something we can talk about another time. Okay, the pharmaceutical approach. Now this is really significant. So again, if you have type 1 or type 2 diabetes, what they typically do is they'll give you metformin or insulin or statin drugs. What these pharmaceutical drugs do is they actually increase your insulin. And when you're diabetic, type 1 and type 2 diabetes, you have type 1 or type 2 diabetes, what you don't want is, specifically we'll talk about type 2 diabetes, what you don't want is you don't want large amounts of sugar or glucose or insulin in the body, because if you have too much of it, it's very caustic. In fact, insulin and sugar are some of the most caustic compounds or hormones in the body, and they'll actually destroy you from the inside out. So even medical doctors will tell you that the goal, if you're diabetic, is to decrease your insulin. But unfortunately, all these medications, metformin, insulin, statin drugs, increase your insulin, make the problem worse. And so again, if your insulin and your blood sugar is increasing, that's going to lead to neuropathies, joint issues, and vision issues. So again, we'll talk a little bit about the approach for applied kinesiology. What we do is I want to look at the gut. Because if your gut's not doing well, that's going to lead to autoimmune problems or loss of inflammation, which then causes issues in your pancreas. With your liver can have congestion, or you can have fatty liver disease, where if the glucose isn't being absorbed in the body, then it can congest and cause issues in the liver or the adrenals. You can have adrenal fatigue syndrome, or even like pregnancy can lead someone into adrenal fatigue. So these are all factors we want to control, and these are things I would evaluate. Okay, so treatment. Treatment from an alternative, holistic, non-pharmaceutical perspective. So the question is there a way to to get rid of the insulin resistance? It's what we talked about, insulin resistance. Is there a way to reduce insulin in the body and reduce sugar in the body as well? Because again, we're going to be killing the body from the inside out. We don't want that. So the first thing I do is I would put patients on ketogenic diets, and what that does is that switches the body from utilizing sugar, and instead they start utilizing fat for their energy. And this actually greatly reduces inflammation in the body and allows the body, gives the body a chance to heal itself. Secondly, I put a patient on intermittent fasting. What that means is you're going to be eating maybe within a 4-hour period. So in 4 hours, you got to fit all your calories in. Then the remaining 20 hours, you're fasting. This does is, so you're only like eating maybe twice a day. And what you're doing is you're resetting the body's system so that your body can start responding to insulin once again. You won't need as much insulin, so insulin begins going down, and the body begins absorbing more glucose into the cells. So the ketogenic diet, intermittent fasting, are very important. And let's see here. Oh yeah, and so there's a story. Years ago, they took two groups. There's a doctor. He took type 1 and type 2 diabetics, and he brought them to a ranch. I think it was in Arizona. And for 1 month, all they did was they ate raw vegan food for 1 month. And after that month, the type 1 diabetic who had to be on insulin no longer had to be on insulin. The body began producing insulin normally. And the other type 2 diabetics who had high blood sugar of like 300 or 350, they lost obviously a lot of weight, but then their blood sugar normalized. So you can definitely reverse both type 1 and type 2 diabetes just with your diet. Because usually diabetes is a disease of malnutrition, and the causes tend to be eating way too much processed food, refined carbs, and also eating way too much. Let's talk about the 5 factors a little bit. So again, we're dealing with chemical stress, emotional stress, mental stress, structural stress. We're trying to reduce the stress so the body can simply heal itself. Let's see here. We'll talk more about this another time. So let's talk about some of the foods that help. So what can you eat? So first off, we want to increase the effect of insulin. So what you'd want to do is you'll have to write this down. You want to take chromium, and you can get that at a food store. And secondly, you want to increase potassium. What potassium does is increases the sugar storage and reduces the acid in the body. And if you have too much acid in the body, it causes a lot of issues. And secondly, we want you to take pantothenic acid or vitamin B8. Another thing is we want you to eating avocados and eat brewer's yeast. Avocados and brewer's yeast actually levels the blood sugar. Next, there's a product called D-Flame, and that it reduces inflammation in the body. It's a really, really good compound. I prescribe to a lot of my patients. And let's see, another thing is you can take MTC oil, MT oil, if you're in ketosis. Okay, so Now, homeopathically, again, homeopathy is very safe. You can give it to children if you want to. Obviously, pharmaceutical companies hate homeopathy because it's so safe and very, very effective. Let's see here. So some of the remedies that I would recommend would be Broma augusta, Phosphorus, Syzygium jambolanum, Phosphoric acidum, Gymnema sylvestre. A lot of these names are in Latin. Actually, they're all in Latin. So what they do is they actually push the body to heal itself. And I can figure out, so with my patients, I can figure out exactly which remedies are needed and prescribe it to them. And you can usually find the correct homeopathic remedy at a well-stocked supplement store or even on Amazon. A good company is called Boron. So if you have any questions, please you can send me a text and we can talk about it further. One other thing I'll recommend here, this is really fascinating. So there's an acupuncture point, it's called SP21, and I've had patients do this. So if you find your armpits on the left side, you go down 1 to around 3 inches, you tap this point about 20 times. So take your blood sugar beforehand, tap this point and take it again, and oftentimes the blood sugar will actually decrease instantaneously up to 100 points. I had one patient, and I told him to do this. He honestly didn't believe me, but he went home, took his blood sugar, tapped it, then he took his blood sugar again immediately, and his blood sugar dropped 50 or 60 points. And I didn't tell him to, but he got off all of his medications and started tapping this area. So that's something that you can do if you have type 2 diabetes, just to help balance your, even possibly type 1 diabetes, just help balance your blood sugar. Okay, next we're going to get into a little bit about what I do at my clinic. So if you've already been to my clinics, then you don't have to worry about this, but this will give you a brief overview of what to expect. We'll start with an overview of the tools that I use. First off, I do iridology, homeopathy, I practice applied kinesiology. With my patients, I check their hormones, I check for yeast biofilms, which are little protective pockets that germs and parasites can hide in. I check for heavy metals, environmental toxins, food allergies. I do meridian therapy, where I check people's meridians and I balance those out. I also check for parasites, viruses, fungi. And I also do Bach flower remedies. And we'll talk a little bit more about that. But iridology is absolutely fascinating. I used to practice this in hospitals in the 1920s until pharmaceutical companies had this system of medicine kicked out, place of their own. So with iridology, by looking at the iris, I can actually see how the organs of the body are doing. I can see the kidneys, I can see the thyroid, I can see the brain, I can see the nervous system, the guts. I see all the organs of the body. I can see if there's inflammation. I can see if the blood's not flowing well. I can see if there's physical problems in the colon itself. It's absolutely indispensable in my practice. Again, homeopathy. It's very safe. It works on the energetic level, and there's hundreds of remedies. And it's very, very effective. And then there's one remedy called arnica, and what it does is it reduces bruising and inflammation and increases healing. It's so effective that it's common for surgeons to prescribe arnica to their patients after surgery because it increases their healing and decreases their bruising afterwards by about 50%. It's very effective. And homeopathy is used in mainstream medicine in multiple countries, India, Mexico, multiple European countries as well. So next, I do nutrition herbology, so I can figure out exactly which systems in the body are weak. and exactly which nutrients, with minerals, with vitamins, even what herbs the body needs. Next is applied kinesiology. So again, with applied kinesiology, it's developed by Dr. Goodhart in the 1960s, and it's a diagnostic system using muscle testing. It's so effective that Dr. Goodhart was the very first chiropractic doctor invited to treat patients in the Olympics, and I believe it was 1974. So one thing we do is, again, we focus on chemical stress, mental stress, and structural stress. And this system combines multiple disciplines: osteopathy, Chinese medicine, chiropractic medicine, and naturopathy. Yeah. Again, I do in-house testing, so I can tell the patient's hormones are high or low. I can check heavy metals, I can check biofilms, environmental toxins, food allergies, microorganisms. In fact, I had one patient who, I tell this story. She was a doctor who couldn't practice much because she had this terrible fatigue, terrible gut issues, and so we were able to figure out that she had parasites, and we were able to treat the parasite. And afterwards, she was much better afterwards. Again, we have Bach flower remedies. There are certain flowers that are medicinal. They give off an essence or an energy that's healing. You can capture those frequencies in vials, and they can actually be used to treat unconscious limiting beliefs. So I believe it's 80% of our emotions come from the subconscious, and so this allows me to treat patients at a very deep level. It's been very effective. Again, I do meridian therapy, so it's Chinese medicine, so I'm able to figure out which flows of energy are blocked. And I don't use needles. I mean, but I tap and I use lasers, and I'm able to remove the congestion and the flow of energy in the body. And this allows me to treat people emotionally as well, with anxiety, grief. I found it to be very effective. So lastly, so if you haven't seen me before and you'd like to try a visit, you can go ahead and use the seminar code if you're when you go to book a new patient visit. Let's give you $10 off. And well, I hope this was helpful. If you have any questions, please let me know. All right, take care.